views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Public Health America, a 30-minute program on BronxNet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents, but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college, but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. It is my pleasure to have with us today Dr. Ryan DeLapp, clinical psychologist at Albert Einstein Student Mental Health Center and an attending psychologist at Montefiore's Child and Adolescent Psychiatric Outpatient Division. Ryan, welcome to the program.
Thank you for having me.
My pleasure. So Ryan, I know you've been doing a lot of work in mental health, cognitive behavioral in particular, of a variety of disorders. Why don't you set the table and tell us about your work?
Yes, it really starts off with, for those of you who don't really know what cognitive behavioral therapy is or CBT, it's a type of work or intervention that we use for anxiety and depression and other types of concerns. And really, my work has been first learning the intervention, being able to know how to not just do the intervention, but do it with people who look a lot of different ways. And then the other piece is trying to make this intervention accessible to more people, regardless of what their background or socioeconomic status is.
Wonderful. And do you work mostly with children, adolescents, adults, all of the above?
All of the above, but most often it is with children, adolescents, and young adults. And that's really the age range that really got me really passionate about this work.
And where I'm asking this question for a very specific reason that will become clear in about 30 seconds. Where do you do most of your work from a location standpoint?
So I'm located in the Bronx, and I'm particularly across two different settings in the Bronx. One is the Moses campus. It's like Norwood area. And then the other area is Morris Park, which is where the Einstein kind of medical school is. And I work with medical students over there as well. Great.
So exactly. And what I wanted to ask is, so you've got to help me here because I could be off base.
Okay.
What I read, and I've worked in the Bronx for 8 years now, what I read and what I experience is, incredibly caring parents and families connected to communities, but not necessarily connected to health and mental health services. What's your experience? And if I'm even close to right, what do we need to do to change that?
Great insights. I think a couple of things when it comes to mental health. You have to also understand that this is a field that's relatively young, and many different people have different opinions about what you can do to actually have good and healthy kind of mindsets, right? And so sometimes, psychology or coming to a clinic like the ones that I work at doesn't really factor into the solution for having good mental health. However, like for example, other places that people might look are, churches or things along those lines. And so that's just one of the reasons why families sometimes aren't connected is sometimes these are places that may not fit in that solution that people consider. However, on the other hand, mental health is sometimes really hard to come by, right? If you decide that you're going to take that leap and try to meet with somebody, then you have to jump through a lot of hurdles, right? Like, where do I find the right provider? Is this provider going to look like me? They're going to understand and respect my experiences. And so sometimes it's a little bit harder than just taking the leap and saying, I'm deciding to take advantage of this resource. Then you have to jump through a lot of hurdles. And that gets to the second part of your question, which is, what do we need to do?
So let's go there. I mean, that's an exceedingly apt discussion of barriers and hope associated with trying to engage young people or people of any age with mental health services, cognitive behavioral in particular. And you mentioned outreach to faith-based organizations, which makes a lot of sense to me. What do we do to, and I'll even throw this out, trying to increase vaccination rates in the Bronx that, relatively speaking, is a little bit lower than other boroughs, and that puts folks at risk. How do we reach out? Are you reaching out to folks, and what are you doing, and what do you find that works to get people engaged, and what do you find that doesn't work? If that's a fair question, and feel free to revise the question as needed.
And engaging people in mental health care, right?
Yes.
Okay. I think it first starts off by making sure that people are aware that the resource is available, and allowing people to know where they can go and where the clinics are located. I think the other piece is being able to, and this is some of the work that I find to be extremely important, is making sure that we're listening to the communities that we're trying to serve to figure out what is it that they're actually looking for, and making sure that what we have to offer aligns with that. And so one of the things that when it comes to, cognitive behavioral therapy, it's a well-researched, it's what we call an evidence-based intervention. And so what that means is that it's been studied in quite a few populations of people. But what we also want to make sure is that some of those populations of people that we're considering it for are the Bronx, and people who are experiencing some of the things that are going on here. And so that's the other thing we have to do, is make sure that when families get into our clinics, we're offering them things that they feel are useful and are meeting their needs. And then the last thing I would say is just really working on insurance coverage, making sure that families are, not necessarily limited by restrictions on how many sessions they can have, and that the providers that are offered in their networks are providers that are qualified to serve the needs that they're seeking. So I think there's a number of different ways in which we can help to engage. But I think first it starts off by making sure that they're aware that we exist and that we can meet the needs they're looking for.
That sounds great. I have to share with you, roughly 100 years ago, I interviewed Albert Ellis in his office in Manhattan early in my career. And it was an open-ended interview where I got to ask him anything.
Okay, that's awesome.
Yeah, it was awesome. But I won't bore us to death with that interview. Let me ask you this. How much of your work intersects with public schools or schools generally, K through 12 in the Bronx? Because it seems to me that an arena in which to interface with mental health is schools. Is that a key arena, or is it? Are they coming to you?
I think that is a key arena. That's not personally the work that I'm engaged in, but Montefiore definitely has school-based clinics in many of the different public school systems where there is a psychologist or some sort of therapist, whether it's a psychiatrist for medication purposes, and some form of a therapist, whether it's a social worker or a psychologist, who can offer some support to students. And then also another way of trying to increase access to care is Montefiore also provides a program called BHIP, which stands for the Behavioral Health Integrative Program, or I think that's what it stands for. But essentially what it is it's putting psychologists and mental health services in primary care clinics with pediatricians and such. And so really the idea is trying to identify these access points where people are naturally going to be, and putting mental health services there. So that's definitely something that's being done. However, that's not necessarily the work that I'm doing.
Got it. Now, I know that some of the work you're doing is around racial stress and trauma. And having moderated a couple of panels with young people in the Bronx, it was just so evidently clear that very real trauma, I mean, was even thought of as normative stress, which it simply isn't. Tell us about your work around racial stress and trauma.
Yes, I think this work started when I was back in graduate school, and really my interest in trying to understand the coping response. What does coping look like when one is trying to um, deal with the reality that in different environments that they could experience this? And so over the course of time, I've learned about assessing it and the different ways that we can help in the assessment of what racial stress looks like. And that has now kind of coming to and it's also developing kind of this idea of what coping looks like. And then us coming to this idea of me trying to develop, along with colleagues here at Montefiore, a program that of like a group intervention that we can offer youth and young adults to help them better understand what they're experiencing, why they are experiencing it, and then ultimately what they can do to help themselves in the environments that they have to be in.
So with about a minute left, I think it's important to define for our audience what we mean by trauma.
Yeah.
I've got a couple of examples, but I'd rather defer to you.
So I think that the idea I use these words differently, right? And you're spot on. Racial trauma and racial stress, I'd say, are different. I think racial trauma, it implies that there is a traumatic event or traumatic sets of events that one has encountered, and it is kind of leading to this kind of what we think about like almost like a PTSD type response, where somebody is really really avoidant of certain environments because of how painful this experience has been. Maybe there's a lot of memories, there's a lot of flashbacks, there's a lot of emotion that's built into being in these environments, and it really exerts a heavy load on individuals when they are close to possibly experiencing it again. Whereas I would say racial stress is something that's still important to note and still carries an emotional weight, but maybe it doesn't reach that level of intensity that racial trauma might have. And then the last thing I'll share is that, another quality of racial trauma that we try to identify is if there's any type of attack on one's personhood or body or any act of aggression towards them, that would also raise it to that level of a traumatic experience as well.
Absolutely. And I think that's such an important distinction. And I think amidst all the stress, chaos, trauma, pandemic that we face, those differences become subtleties, and yet they're not. They're not
right.
Subtleties.
And I want to clarify that stress and trauma, some of that is a bit semantic, because really what it comes down to is they all have the ability to be extremely painful and hurtful. And also, they also are things that people can be empowered to try to handle and navigate. And so I think it's on both sides.
Very good. When we return, we're going to take a quick break. When we return, Dr. DeLapp will tell us a little bit about his experience and his life story that enabled him to embark upon this great career. We'll be back in a minute. This is Public Health America.
If you're struggling to afford your internet bills during the pandemic, there's a temporary government program that may be able to help. It's called the Emergency Broadband Benefit, and it provides up to $50 monthly discount on your broadband bill to qualifying households. Find more information about the program, including if you qualify and how to enroll, at fcc.gov/broadbandbenefit, or call toll-free at 833-511-0311. That's 833-511-0311.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, they want to be tested.
When things were happening in our community and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Reporting from Broadband, this is
Welcome back to Public Health America. I'm your host, Dr. William Latimer. I'm here today with Dr. Ryan DeLapp of Albert Einstein and Montefiore Child Adolescent Psychiatric Outpatient Division. So Ryan, in this segment, we talk a little bit about your experience and what enabled you to establish this great profession that you have. So tell us, I always start with the same question. Tell us a little bit about your formative experiences and where you were born.
So I'm happy and proud to be from the South. I'm from Winston-Salem, North Carolina. And I would say it's really important. I mean, I think when I think about this career path, it really starts off with my parents, right? I think my mom's a social worker. And so I was always exposed to the human services field and really caring for people who are really just experiencing some unimaginable circumstances. And then I was also, my dad, he's an entrepreneur. He works and thinks outside the box and tries to challenge some of the things that are maybe considered status quo. And I think putting those two things together for me really helped me to kind of think of a career that might allow me to do both of those things together. And so it wasn't until probably high school that I actually discovered this career of psychology, where I took an AP psychology course. I believe it was my junior year in high school. And it was there that I started understanding more about human behavior and human experiences. And I became hooked. And then I would say the next kind of childhood experience that really kind of helped me to kind of solidify this career path was I worked as a summer camp counselor at my local YMCA. As a teenager, I was working with other teens, which kind of seems kind of odd. I was like 16, 17-year-old working with 13 or 14-year-olds. But I recall interacting with a teen who was going through a really tough time. And I didn't know what to say. I didn't know how to help him.
Sure.
And I wanted a career that really taught me ways that I could be a resource in those moments.
That's so great. I have to ask, where in North Carolina?
Winston-Salem.
Sure. Yeah, my wife is very proud to have been born in New York City, but she was raised in Carborough, Chapel Hill. So there's North Carolina connections there. That's a wonderful story, and it sounds like your mom and dad were really great, sort of nurturing mentors for you. Where did you do your undergrad?
Actually, at the University of North Carolina, Chapel Hill.
There you go.
There we go.
Hey, there's a great. I've been there.
Yeah, that's a picture at the old well on the North Campus, and I'm a Tar Heel born and bred. That's the mascot for those of you who aren't familiar with the UNC, and I love my time there.
That's so great. UNC Chapel Hill, one of the best public national universities in the world, bar none. What was were you a psychology major, or what was your major?
I was psychology major, African American studies minor.
So great. So tell us about your experience at UNC. Were there like important mentors? What were the experiences that kind of enabled you to optimize the experience you had?
Well, I mean, this is not going to sound too academic, but UNC is also a big sports place, and I'm a big sports guy myself. So I definitely wanted an institution that gave me an opportunity to be a fan. I also played basketball there on their JV basketball team, which was really awesome. So sports was definitely a big part of my college experience. And then in terms of mentors, I mean, I really had such excellent mentors, and actually had Black mentors, which I thought also was really great to have. People who looked like me, who had been through this higher education journey, and I could always talk to. And so I thought that was a really great opportunity to have. Some of them include Dr. Enrique Neblett, our current colleagues now, but a friend of mine by the name of Dr. Sean Jones. And these are individuals who really kind of took a young kid who was just saying, hey, I want to do psychology, and told me about what the next steps actually look like. And I would say lastly, it was the opportunity. I mentioned I'm an African American studies minor. You know, in my K through 12 years, I really didn't get the opportunity to learn about Black history and Black culture. And so it was when I got to college that I actually was able to appreciate that was a course of study, that I could actually go into a classroom and learn about me, and learn about my history, and learn about kind of how that has connect myself to my own heritage. And that was also an awesome opportunity to not just have school be about history, English, or topics that I was told I had to study, but I could choose what I wanted to study. And that was an awesome opportunity too.
That's so great. And, you know, I want to pick up on a couple things, but one, you know, we've yet to have a segment in Public Health America where we talk about the interface of athletics and undergraduate experience. And I very much want to publicly state, as a 30-year academic, that the coaches and the athletic directors that I've worked with are unbelievably important mentors and student success counselors to the countless students that are student athletes. So that athletic experience that you had, you know, and you're saying that it was very helpful, that I think that's so important. And that's another sort of venue in which student success, academic success can be mentored and nurtured at the undergraduate level. I think the other key point that you make is that you're very explicit and clear and compelling about the mentors you had that invested in you and let you know that, you know, you could pretty much do anything that you wanted to do. So I just want to highlight those 2 points because I think they're so important. So you complete your undergrad at UNC. What's the next step?
So the next step really was figuring out what I wanted to do with my psychology degree. And, you know, I knew that I wanted to pursue psychology and particularly becoming a psychologist. And so that required me to pursue my Ph.D. And so that took me to the University of Louisville in Louisville, Kentucky. That was also an amazing experience too. I wanted to particularly focus on what's called mental health disparities. And what that essentially boils down to is how do we address the fact that, as I was saying in the previous segment, that there are some people who get access and there are some people who don't. And there are some people who benefit from the things we offer, and there are some people who do not. And I wanted to have a place to study that, and University of Louisville provided that for me.
That's wonderful. How did you make your way from North Carolina to Louisville to New York City? How did that happen?
So in the process of getting your PhD, you have to do what's called a clinical pre-doctoral internship, very similar to like a residency for medical students. And so I applied, and just like in medical school, you have to do a match process where you apply and put your name in and you match to a place and they tell you where to go. And I happened to match to Montefiore Medical Center, which is where I did my internship many years ago. And then I decided to come back and become an attending here and work on staff.
Great, great. And if you were to give advice to young people or non-traditional age folk that to help them get to college based on your own experience, what would it be?
I'm a big fan of this statement I say is like staying on path. And I'll explain that as quickly as I can. And that is, your path is knowing what it is and finding out what it is that you want or that you feel that you need out of life to have an enjoyable life. And for me, college checked all those boxes. Like I wanted the athletic experience. I wanted the social opportunities to meet people from all over the world. And I wanted an experience that helped me to set me up to pursue a career that I thought would be fulfilling for me. And college was the place for that. And so my encouragement to everybody is to, your story may not sound like mine. You may not know what you want to do in high school, but college is also a place that would help you to figure that out. And by exposing you to a lot of different things so you can clarify your path as well. So that would be my encouragement is to find a place that seems to best align with the path that you possibly see for yourself and utilize the experiences there to clarify it.
Excellent. Now I'm going to ask you not the most important question of this interview. Did UNC go to the Final Four when you were an undergrad?
They did. They actually won the national championship when I was an undergrad.
That must have been amazing.
That was amazing. For those of you who maybe don't know about Franklin Street, where everybody rushes the street,
right.
And it's an amazing experience.
So not to hammer this home too much, but obviously it seems to me that you had a wonderful academic experience and you had a wonderful overall experience throughout your academic history, whether at UNC or Louisville, and you found great mentors. You had great experiential learning opportunities, and that those and parents who supported you, and those things together enabled you to set up a profession as opposed to a job that allows you to do the things that you want to do. Is that reasonably fair?
It's a fair assessment. Absolutely.
Sounds great. Well, listen, I want to thank you, Dr. DeLapp. It's been an absolute pleasure to speak with you. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. See you next time on Public Health America. Take care.